the stat around what certainly ruminant agriculture or animal agriculture is contributing to greenhouse gases is far more insignificant than what we're being told.
Yeah, absolutely. I mean, it's not nothing, right? It's there. They've estimated it, but in the U.S., for example, all of agriculture is somewhere around 10% of anthropogenic greenhouse gas emissions.
That's whole of agriculture rather than just animal agriculture.
Yes.
Okay,
exactly.
and then if we boil it down to animal agriculture, do we know that the segmentation?
It's less than half. It's about 4.
Okay.
And if we look at beef, it's less than half of that. It's 2.
So if we cut that out of our diets, not only would we be more nutrient deficient in many things, we'd also have a very small impact on the actual climate emissions, and we'd have a bigger impact on the amount of emissions that are caused from disease-related illness.
Yes, and we'd have to increase the emissions coming from plant source food production. And it's not a 1-for-1, right? Because the animal source food is more valuable, so it would take more to replace it. But we also have then the reality that our entire food system is integrated. So we can't have sustainable food systems without livestock agriculture in general and ruminant animals in particular. So there's that. We would be forced to take more marginal land out of production in order to produce the increased amounts of plant source foods. If we look globally, and there was a paper where they tried to estimate what that impact on greenhouse gas emissions would be. And I think in the US, it would be somewhere below 2.5% reduction, but it would come at the cost of, they said, creating, I would say, exacerbating essential nutrient deficiencies and imbalancing the food system. Globally, it would be like less than 0.5% impact of eliminating animals agriculture in the US. And of course, we need to point out that the animals don't get to hang around, right? So they get eliminated. So after the world's largest barbecue, we're left with this sort of, and meanwhile, I can pull the paper that said that the healthcare industry in the United States is a significant source of pollution, including 10% of anthropogenic greenhouse gas emissions. Now, those aren't apples to apples comparisons, right? Different methodologies are used to create them. The point is, it's there, it's large. And it's going to get bigger because we know the burden of chronic disease is getting better. And we know that the people who are trying to solve that issue tend to bring their mindset of what a healthy diet is, right? So they're going to tell people that they need to exercise more and eat less and et cetera. And we know that that hasn't worked. So, globally, there's estimates of the emissions intensity from the pharmaceutical industry alone. People have taken that number and they've applied it to a dollar figure and said that if, based on the pharmaceutical spend for the average American type 2 diabetic, the average American adult with type 2 diabetes, they aren't their disease, they have the disease. That if they could eliminate their medication use, they'd reduce their carbon footprint 29% more than if they went from a high meat to a vegan diet.
Wow. And we don't hear this at all, really.
No, we don't hear that. And so, there's a lot of hand waving in those estimates. I admit all that. Again, the point is, whatever
even if you halved
is,
it.
Yeah. It's like a car's worth of emissions per year. It's like, and so we need to have that more fulsome conversation about this, because again, we're only looking at greenhouse gas emissions.